Hi there, it's Dr. Suchard, and this time, for this series on clinical toxicology, we'll be discussing inhalants, corresponding to Goldfrank's Chapter 81. The learning objective for this session is that you'll be able to name at least 3 substances abused through inhalation for their central nervous system effects, which is to say that people use them to get high. And you'll notice that there is no learning objective here about treatment or the dosing of any medications. While some inhalant exposures may result in conditions that have specific therapy, and I'll be mentioning some of these in this video, the great majority of inhalant exposures will cause CNS effects that reverse just by stopping the exposure. On to the inhalants, and the picture here shows many of the products that might be misused this way. Several vapors and gases can be abused as central nervous system intoxicants and euphoriants through inhalation. I mean, that's basically exactly how inhalational anesthetics work, so it makes sense that some other chemicals might be able to do similar things. Some information resources about inhalants split them into 4 categories. Liquids and aerosols, which are usually volatile organic compounds that can be suspended in the air or mixed in the air and then inhaled. There is one common abused inhalant that is itself a true gas, and that's nitrous oxide, which we'll touch upon later in the video. And then there are the nitrites, which have a very different mechanism of action, but they are still misused or abused through inhalation, hence they are inhalants too. The chapter notes appropriately that inhalant users are often younger and or more financially disadvantaged compared to populations with exposures to other substances of abuse. And this probably reflects the fact that the inhalants tend to be found or inexpensive, legal and perhaps seemingly innocuous items like aerosol air fresheners, glues and rubber cement, whiteout, paint thinner, gasoline, butane, etc. These are the products that they can access and use for their desired CNS intoxicating effects, whereas if they had the money and the access, they might have chosen different substances. Inhalants can be used in a few different ways, such that the user can control and can increase the dose they're exposing themselves to. Inhalants are typically first used through sniffing. The user opens the container and simply sniffs the vapors from that open container, which entrains a lot of the surrounding normal air along with it. This can progress to huffing, where the user is inhaling through a rag that is soaked or at least moist with a liquid inhalant, increasing its relative concentration in the inhaled air. The inhaled dose can be increased further by bagging, where the user places that same soaked rag or a liquid inhalant into a plastic bag and just breathes in and out of the bag. And in the worst cases, they can even put that bag over their head, which seems very dangerous for a few reasons. As a general effect of these inhaled hydrocarbons and volatile organic compounds, you get various CNS effects along a spectrum depending on the dose. The user is looking for euphoria and maybe hallucinations, and then they can also have headaches, dizziness, ataxia, an unsteady gait, lethargy, or coma. And while CNS effects are common, indeed they are the intention of inhalant abuse, the more dangerous effect that may be seen, which is believed to be responsible for most inhalant-associated deaths, is this thing called sudden sniffing death. Exposure to many inhalants can sensitize the myocardium to endogenous catecholamines. This means that the person's normal epinephrine and norepinephrine are more likely to induce a dangerous cardiac arrhythmia. A classic case would be if the user was surprised when someone else found them abusing their inhalant, so they started running away. They were having a fight-or-flight sympathetic response, increasing their circulating epinephrine levels, and because their heart was now overly sensitive to the beta-adrenergic stimulation, that provoked an arrhythmia, perhaps ventricular tachycardia, and they would appear to just drop dead, a sudden sniffing death. It has even been suggested that sudden sniffing death patients may need treatment with beta blockers to counteract the myocardial sensitization, and it would certainly be unusual to use beta blockers to treat cardiac arrest, since we're usually giving these patients a lot of epinephrine, beta agonism, instead. So those are the more general statements about inhalant effects, but there are some agents that have other notable associations. Chronic toluene exposure can result in kidney injury and renal tubular acidosis. Carbon tetrachloride and some other halogenated compounds can cause liver damage, and methylene chloride, a common component in paint strippers, is metabolized into carbon monoxide. And there's a couple more, such as chronic exposure to N-hexane can produce a peripheral neuropathy, and there's a surprising number of people abusing dust-off, which is supposed to be used to blast dust off of your computers and electronic equipment, and which contains difluoroethane. It wouldn't surprise anyone to find a can or two of dust-off near your computer, but some people abusing it will have dozens of cans around since they use so much every day. and all the extra fluorine they're exposed to can cause skeletal fluorosis. Nitrous oxide is used therapeutically as an inhaled anesthetic gas, both by dentists and by anesthesiologists in the operating room. But it is also widely abused and available legally for use in high-performance cars and also to make whipped cream. The small canisters of compressed nitrous oxide are sold, for instance, through restaurant supply companies, but I'm pretty sure that a large portion of the product is diverted for recreational use. The various metal parts shown in the photograph here are used to crack open and control the release of the compressed nitrous, and it's often used to fill up balloons which the user then breathes from. The nitrous containers are commonly called whippets, from a brand name of nitrous for making whipped cream, and the metallic gear to open the containers when you're not actually making whipped cream are called crackers. An exposure, or a few exposures, to nitrous oxide are probably not dangerous, but chronic repeated exposure can and has resulted in neuropathy. Nitrous oxide interferes with vitamin B12 metabolism, resulting in a functional deficiency and what can be a severe neuropathy. I've seen patients with this neuropathy a few times in the emergency department, and most have required admission to the hospital because they don't usually show up until they're barely able to walk. Now I'm going to be showing you a video of a patient with subacute combined degeneration of the spinal cord, which is the kind of neuropathy you can get from B12 deficiency and nitrous oxide abuse.
โอเคลองกอดอกครับกอดอกไว้ตลอดเลยนะแล้วก็หลับตานะครับหลับตาครับหลับตาไว้ตลอดเลยครับเดี๋ยวถ้าเกิดล้มเดี๋ยวหมอเขาจะอุ้มไว้เลยครับไม่ไหวเนาะไม่ไหวนะครับเดินนะครับน้องตั้นเอาขากางเกงขึ้นหน่อยดิน้องตั้นระวังคนไข้ล้มหมุนตัวครับหมุนตัวครับยืนครับหมุนตัวอีกทีหนึ่งหมุนตัวอีกทีหนึ่งครับโอเคกอดอกหลับตาอีกทีหนึ่งได้ไหมครับโทษนะครับหาคนปิดตาคนไข้สักคนหนึ่งนะปิดตาไว้เลยน้องตั้นปิดตาไว้เลยแล้วก็หากอีกคนนึงล้มอีกคนนึงกันไว้โอเคพอแล้วขอบคุณมากครับ
And finally, we'll look at the nitrite inhalants. There are various alkyl nitrites, often referred to as poppers, that are sold with the intention that people will sniff them and get a head rush and euphoria. Also, the nitrite group on these compounds will enhance nitric oxide-associated muscle relaxation. Some of the products shown here make it more clear that these are intended for recreational use, while some others are sold with labels that are less clear. Some nitrites are labeled as room deodorizers, when, if anything, they would just stink up the room if you left them open. That's just an intentional misdirection on the label, probably for legal purposes. These nitrites can cause methemoglobinemia, which is a topic covered in a different video in this series. I'd be sending labs to check for methemoglobin if I saw any patient in the ED after use of poppers. And a final word of caution, these products are intended to be sniffed, since the active compounds are volatile, and that method of exposure will work. But you're not supposed to drink them, even if the bottles kind of look like 5-hour energy shots. If that happened, and it has, I'd be very concerned about hypotension and methemoglobinemia. That's all I have for you about inhalants. I'll be seeing you around.